Hi, my name's Tracy Brown. I'm the CEO of the American Diabetes Association.
I'm Dr. Robert Eckel. I'm Professor Emeritus at the University of Colorado College of Medicine, and also I'm President of Medicine and Science for the American Diabetes Association.
So as we've always said, with COVID-19 continuing to evolve very quickly and be fluid, we are always going to come to you with the most up-to-date and accurate information. And I am very excited that we have Dr. Eccles here with us today to share some critical information regarding some of the questions that we have been receiving. So thank you, Dr. Eckel, for joining us today.
You're welcome, Tracy. Good to be with you.
So the first question I have for you, Dr. Eckel, is really just around, are people with diabetes at an increased risk to being infected by COVID-19, and or are they at increased risk for suffering from complications from the virus?
I think it's important to begin an answer to that question to indicate most of the data we have that's been peer-reviewed and published in high-impact journals indicates the Chinese experience. COVID-19 is now a global experience, and I'm counting on data coming from Europe and ultimately the United States that's going to be able to answer this question much more succinctly. However, the risk of patients with diabetes for COVID-19 in some studies out of China have shown an increased risk, but others have not shown an increased risk. I think we're just too early on to this pandemic to make a clear answer about that. However, once infected, patients with diabetes may likely experience a less favorable outcome. So I think we want to protect our patients with diabetes as much as possible for coming in contact with people with COVID-19 or being exposed to the virus in other means.
Thank you. And in continuation of this thought, Bob, there's a lot of conversation out there on whether the risks are similar for people with type 1 diabetes versus type 2 diabetes or gestational or any other type. What are your thoughts on that?
Well, the Chinese experience and the published papers that we've seen have not distinguished type 1 from type 2 because age is so critically important in outcomes. In other words, older people do less well in general with or without diabetes. I suspect most of these patients with diabetes who have had unfavorable outcomes, including death, have been older and have type 2 diabetes. So ultimately, the type 1 patient may be immunocompromised, which means an immune system that doesn't work perfectly well, and also be at greater risk and do less well. But here, I think another important factor comes up, and that's the duration of diabetes. We could have a type 1 patient in his or her 20s with 10 years of type 1 and probably have not much risk beyond the usual subject. But a type 1 with 50 or 60 years, like yours truly, ultimately may carry a much increased risk because of changes in the body that relate to duration of diabetes. So age, duration of diabetes, I'm not sure at this point we can clearly distinguish type 1 from type 2 that's not age related.
Thank you. And then last question is just, you mentioned the word immunocompromised. I see, again, in the social space, lots of people talking about that. What does that actually really mean? And particularly as it relates to your blood sugars and managing them. Like I've heard some people talking about, well, if you have well-controlled and managed your blood sugars, your body is not immunocompromised. Is this true, or what does this mean?
Well, immunocompromised is typically a medically used term that relates to an immune system that is not totally optimal in terms of the response to infection. I think here's a term called innate immunity, which is the ability of our bodies to fight out any organism that would offend our body. And that could be a bacterium, a fungus, or a virus like COVID-19. And that immunocompromise relates to a chronic inability to mount the immune response that would be seen in people without diabetes. Now, the whole relationship between glycemic control and immunocompromised state relates to a couple of things. Patients with type 2 diabetes have a kind of chronic, mild, pro-inflammatory state. That means they're already kind of acting like they have a low-grade infection. They don't. This is typical of the insulin resistance we see in type 2 diabetes. And in those patients, the ability to mount a white cell response and have those blood cells function normally may be compromised. In type 1, control probably is important. And again, duration of diabetes and age relate to this immunocompromised state. So ultimately, I think, again, in patients with diabetes, we need to avoid COVID-19.
And I'm going to end that right there. You've heard it from Dr. Bob Eckel, hopefully giving all of us who are living with diabetes more information around COVID-19 and the number one point, we need to avoid COVID-19. Thank you, Dr. Eccles, for joining us today.
Thank you, Tracy.